Hello everyone, welcome back to Rapid Review for MRCEM exam. We are going to discuss another question on the topic of major trauma. The question is, we have got a 30-year-old male who is brought to the emergency department following blunt trauma to the chest. He has no obvious signs of chest injury but reports severe pain on the right side, which is worse with breathing. On examination, his respiratory rate is 24 breaths per minute and there is decreased breath sounds on the affected side. A chest X-ray revealed pulmonary contusion with no rib fractures. What is the most important aspect of initial management for this patient? So I've got Sam with me who is going to answer this question.
Okay, so A, administer crystalloid fluids aggressively. There's no indication for that in this question. B, provide analgesia to improve ventilation. So that's definitely a contender because respiration will definitely be improved if we reduce his pain. Perform intercostal nerve block. Again, this can be massively useful. However, in terms of initial management, that's not generally our first stop. D, monitor arterial oxygen saturation and end-tidal CO2. So we definitely would want to do that. In terms of initial management, I'm not sure that that's the most important, but that's potentially. Initiate early intubation with mechanical ventilation. I don't think we've got enough of a justification to intubate this patient, so I'm going to say it's between B and D. I think at this point, analgesia would be my first go-to to see if we could get him to increase his own ventilation just by making it more comfortable, so I'm saying B.
Great. Yeah, going through all the options again. So administered crystalloid fluid is not indicated here, and then we need to be careful with fluid administration in the trauma setting. Option B, analgesia to improve ventilation. Definitely it's a part of the management with chest injury. So for me, B and C will be to consider which is the right one. For D actually, so it says monitor arterial oxygen saturation. So here is more like a diagnostic, but the question asks regarding the management. So I will discard treatment option D, and option E is not indicated in this case. So now we have to choose between option B and option C. The studies we know intercostal nerve blocks are quite effective in patients with known rib fractures. Here, number one, we are not sure whether the patient has got rib fracture. Number two, everyone has got skills to perform nerve block. So here the option is option B, which is to provide analgesia. Providing analgesia will improve the ventilation and oxygenation. So you are correct. The correct answer is option B. Well done. Thanks for watching. I will see you in the next video where we are going to discuss another SBA on the theme of trauma. Till then, take care and goodbye.